All right, welcome back to our Physician Leadership Excellence webinar series, session 2. For those who attended the first session, we spent some time introducing the concept of assessments for selection and for development for clinicians in a healthcare system. Got into a little bit of details about what's incorporated in traditional assessments and what you should consider when selecting them. In this session, what we want to do is start to take you through the process of what the experience really looks like as you go through a clinician assessment center. Rejoining us today is Kathy Oswald from the Center for Physician Excellence. She's again going to lead us through this session. And maybe I'll start out with the question about what are some of the typical components of a developmental assessment process and what are you really trying to measure?
Thanks, Mike, and thanks for inviting me back. So what we're trying to measure is really looking at various behaviors, leadership behaviors, how people get things done and how leaders get things done. And some of the components we use are objective tests and inventories. We particularly like the Hogan suite because we like not only does it look at values and normal behavior, but it also looks at derailers. Watson-Glaser is an example from a cognitive testing perspective. We also do career accomplishments and goals interviews, inbox challenges, exercise, take people through about 9 different situations and ask how they would handle them, subordinate peer role plays, and then a business case within pre-work that goes with that. And lastly, then there'd be a robust development feedback session. So all of that or portions of that could make up a typical assessment. And we can offer that in 1 to 6 sessions. It's all web-based platform, so no software needed to install. It's available 24/7. We use Zoom meeting for the face-to-face interaction, so it feels like you're having the meeting and being there with the assessors. And I think the other thing that's really great about it is we can record these sessions for participant feedback and also for quality control.
You know, physicians are always so busy. So a lot of times their calendar is not their own. However, this is such an important process in really identifying that leadership talent. How much time commitment should a leader or potential leader anticipate?
Well, again, it's going to depend on what they really decide, which portions of they decide. But I would tell you if they did the entire thing, they'd be talking about 6 to 8 hours.
Okay. So we have a scenario played out to help people kind of understand the process, and it focuses on Dr. Smith, someone that you've worked with in the past. Maybe tell us a little bit, give us a little context of the reason why you participated in the assessment, and then we can dig into the experience that he had.
Good. So Dr. Smith is, as Mike just said, this is somebody that we actually worked with. And Dr. Smith is an emergency medicine doctor, been practicing in his current health system for about 12 years. He actually did his residency there. And he was recently promoted to chief medical position. And again, in this particular case, he did not go through a robust interview. They really decided that he was the right candidate without doing that interview process. Well-respected ER physician, led emergency medicine for 3 years, has very high patient satisfaction scores. I think one of the things that really was one of those reasons for selecting is he redesigned the ER residency program, which has received national recognition, viewed as a team player by everyone, including employed doctors and our private practice, brought a metrics-driven approach to redesign the emergency department. So a lot of really good things going on. So they assigned him and promoted him to chief medical officer. His system in particular offers each new physician leader and actually each new administrative leader an opportunity to participate in a leadership assessment process and provides an onboarding coach for the first 6 months. So this assessment was part of that process.
So why don't you share now a little bit about the experience that he had going through the process?
So in Dr. Smith's case, he decided to do this in 4 sessions. He wanted to do his first session would be the testing. And the way we do that is we send the link to the participant, and they really have 2 weeks to complete it at their convenience. In his case, he really got it done in about 7 days, and we moved on from there. His next session is really the first time he'll meet the lead assessor. When we do one of these assessments, we do have a lead assessor that writes the report and puts everything together as we go through this. So he met his lead assessor. She conducted the career accomplishments interview, and then she reviewed the mechanics of the system. It's really so easy to use. If I can do it, anybody can do it. and Dr. Smith has had no problems. The next thing she had him do was she gave him 1 hour to review 9 challenges. And these are everything from EMR issues to sexual harassment issues, all over the gamut of things that a physician leader would have to deal with. He got 1 hour to read each of the situations in the backup material. And then the assessor, the lead assessor, came back on and they discussed for an hour each of those challenges in detail and really talked about how he would handle those. Next was his session 3 was with another role player. We really like to get different perspectives and different people viewing the individual. So another role player came on to do the peer and subordinate role plays. Again, review the background information. These are really quick hitting. So the physician leader had 10 minutes to read what the subordinate role play was about, think about how he was going to handle that. And then 10 minutes, he really did a role play with somebody who was the subordinate acting as the subordinate. After that, did the same thing with the peer. A good example of this would be that the physician leader is the head of the emergency department, and he's had a patient that's been waiting 8 hours to get admitted. And it's not a first time. They have a long history of not being able to admit on time. So he's actually going to meet with the CNO, the chief nursing officer, to talk about how they can reduce the time, the wait time to get admitted. Now, as you can imagine, the CNO is not the friendliest person. So really going through that process. That's session 3. And again, it takes about 40 minutes to do both of those role plays. The last is the longer session, and it's really a business case. We really recommend this for mid-level and executive level leaders, not for your entry level. But Dr. Smith received pre-reading 1 week prior to the session. It takes about an hour to read it, maximum to read it, but really to get a lot of background information, such as demographics, competitor information about the health system, et cetera. And he has a chance to read that ahead of time. On the day of the assessment, he's introduced to the session, and he's taught, and he gets instructions about what his role is going to be. And he's actually going to have to make a presentation to the CEO of the system in an hour. And so he is then given 1 hour to prepare to actually meet with the CEO. He's told, this is not do fancy slides or anything like that. We really want you to prepare and be able to think about it. The CEO just wants to hear your thought process, et cetera. And so he's given 1 hour. After that 1 hour, he again meets with a new role player, someone he hasn't met before, and they go through the business case together and spend an hour together. So that's really the scenario that an assessment takes. And then obviously, once this is all put together, there's a feedback session.
Yeah, so let's have you talk a little bit about that, the assessment findings and how that plays. What did you find out in this case?
So interesting. So Dr. Smith met with his lead assessor, and in this case, he had already selected his coach. So his coach was there, which is really great because then the coach gets to hear the results and they can really use this as a basis for their discussions. The feedback session is to review the results and for him to have a chance to ask any clarifying questions. And as I mentioned earlier, it's really great because we have these tape sessions. And so in Dr. Smith's case, there was a couple areas where they were identified as a weakness, and he really didn't see it. So we brought up those videos and really talked about those. Now, Dr. Smith and his coach can use the assessment feedback to help structure their coaching engagement. On the right-hand side of the slide, just a little bit about Dr. Smith in particular. Great at shaping strategy, enterprise, thinking about the system as a whole, focus on patients, resourceful, innovative problem solver, whereas weaknesses were in the area of involving others, especially at the beginning of solving a problem. He would solve a problem and then communicate the problem and communicate what he wanted to do, but really didn't involve people as quickly as he should. Also dealing with conflict, which is absolutely, I don't know if Shelley would say this or not, but as a coach myself, that's something that so many of us struggle with. So he's dealing with that conflict. And then just his communication, much more in a large group than an individual setting. So it got into enough of that detail that I think it really helps the coach when they go forward.
Great. Thank you so much, Kathy. And one of the things that you said that I really like is you started to tie it into that coaching and kind of so now what's next stage. In our next video in the series, Shelley Smith from LAK Group is going to talk a little bit about, you get this data, and as we all know, clinicians, they love data and research because they use that to help make their decisions in their craft. We like to do that with how we develop people as well, and we're going to talk a little bit about how do you take this data that comes out of this assessment and really integrate it into the development process for clinicians in an organization. So again, my name is Mike Grubich with LAK Group. Thank you for taking some time for being here, and we hope you're able to attend the third session in this webinar series. Take care.